Good afternoon, everyone, and thank you for joining us for the School of Graduate Studies open house. I'm Provost Frank Gailey, and I'm going to kick off our visit this afternoon. For our general format today, we're going to provide a few hopefully informational items for all of you in our graduate student positions. And then we have some questions that you sent to us ahead of time. We'll address those questions to the best of our ability. And then we'll move into questions that you can send in to the panel via the chat system. So that's kind of going to be our general format. Some of you may or may not know, but the School of Graduate Studies was moved into the Provost's office just a little bit under a year ago officially. And I'm very pleased to note that we're now under new leadership in the School of Graduate Studies. And one of the first things we hope to do is basically open lines of communication, especially with our graduate students, but also with our departments in which you all reside. And so that's today's forum is really a format for us to help with that communication. We're going to be providing information about items that are obviously on top of our mind. A lot of students returning now in the middle of this COVID pandemic, and we want to get you as much information as we possibly can. If you have questions that we haven't answered about COVID-19 or what campus is doing, I'd ask you to please refer to the all student communications, which you should also have received from President Cockett and also from James Morales in Student Affairs. So lots of communication has gone out. That information is available on the USU Ready website, and you can find that information there. Despite that, our general communications with all of you, please remember that your primary source of information really needs to be your primary or major advisor or faculty member in your department. And I think Vice President Barreau will also mention that that's a great place to go also for planning for your program as graduate students as we go forward. So remember, if you have questions, start with your major advisor. We'll support you and them from then on. I was asked to give everybody an overview on what is Utah State University doing about the COVID-19 pandemic. Let me assure you, a lot. Daily meetings for several of us, dealing with everything from providing for testing to surveillance for the disease, for doing everything we can to create a safe environment. I shouldn't say safe environment, but to reduce the risk in our environment of transmission of the disease going forward, especially in our classrooms and our laboratories. So there's lots of information there, lots of planning is going on, and I want to assure you that we've really got a great team here at Utah State University trying to address everything we can think of related to COVID-19. First off, I want to kind of emphasize, we have a COVID care team and some test kits out there. And I think it's really important for all of us to follow those 4 principles of prevention. And those are wear a face covering. Face coverings are really important. The research will tell us all that, these 4 principles, the face covering might be the most important one. If I'm wearing a covering and you're wearing a covering, the odds of transmission dramatically are reduced. The other is follow the practice of providing distance, at least 6 feet between people who are not within a household. The third thing is good hygiene, washing your hands, good disinfection, those kinds of practices. And then the fourth that we all need to practice, including you, and also encourage your students to do that if you're a TA, is if you're sick, if you're ill, don't come to work, don't come to school. We have been working with faculty members, and we ask you as TAs as well to be flexible around this year as we encourage our undergraduate students especially not to come to class if they're not feeling well. Second, we have a USU COVID care team that's ready to respond and provide services and accommodations to you for your own classes, but also for your students in your classes as well. If somebody becomes ill, has to self-isolate, or has to go into quarantine. This team is activated when students fill out the USU COVID questionnaire. Let me emphasize the COVID questionnaire. In order to reduce risk of COVID transmission on this campus, or anywhere. If you are isolating, if you feel you've been in contact, if you have tested, please fill out the COVID questionnaire, because that is what will help to activate a lot of the support measures that will help you, but also to help you understand what may be going on in your classroom. So I can't emphasize that COVID questionnaire enough. That questionnaire can be found on the USU COVID site, USU Ready, and I'm sure we'll be sharing that with you soon. So fill out the questionnaire under these conditions. You're ill and getting tested. You're waiting for test results. You've received a positive COVID-19 test result. If you've had close contact, or if you've been asked to quarantine or isolate. In addition, Utah State University is providing COVID care kits to all students. And these care kits will be sent out and they will contain a face covering, a thermometer, I think some other little helpful things. I think there's even some hand sanitizer in those little kits. And again, it's a welcome present, but it's also a reminder to all of us to make ourselves in a position where our risk of transmission or getting infected is as low as possible. There's a lot of information out there for you as students, but also for you as TAs. All student emails are available on our COVID-19 website that will be sent to you. There are guidelines for conduct in the classroom as well as in the teaching laboratory. And then there are also guidelines on the well-being area for student well-being. We hope everybody, all students, will take the USU Protection Pledge related to our COVID-19 response. So I think that's, in a nutshell, just a little bit of what we're doing. One thing I would add that's not particularly scripted, but it's hot off the press and we'll be sharing it with you, is that we also have video training available for you. This video training will help you if you are in a classroom or in a laboratory setting and a student is not following good low-risk practices, basically the 4 principles of prevention, ways for you to initiate a conversation without hopefully causing escalation. With that, that's kind of an introduction to the COVID-19 issue. I'm sure there are questions. I know there are a couple questions that are waiting for me for a little bit later. But right now, I would like to introduce the rest of our program. And first, it's my honor to introduce our interim Vice Provost for Graduate Studies, Richard Cutler. So welcome, Richard. We also have a Vice Provost for our global engagement programs, Dr. Janice Bettinger. And Janice has been helping Richard and I as we get our office in line and doing a better job of communicating with you. And then we also are honored to have Vice President Lisa Burrow. Lisa's responsible for research on the USU campus. And I see Trevor there. Trevor's our staff person who's hopefully going to keep us all in line. And before I turn it over to Interim Vice Provost Cutler, I would also like to give a shout out to Anna McIntyre and our entire staff in communications for putting this together. They're the ones that are going to keep this information rolling to all of you. Vice Provost Cutler.
Thank you very much, Provost Gailey. And I second that shout out to project management team and all the staff who have made this come to pass. It's a staggering amount of work that they have put in over the last couple of weeks. So as Provost Gailey indicated, today we're going to have really 2 components to this town hall meeting. In the first part, we're going to share some information that we know that you're going to need on research, teaching, health insurance, mental health, and diversity and inclusion. And then after that, we're going to respond to your questions, some of which we've already received from you. If you still have a question, you can ask them to me and the rest of the panelists using the question and answer feature to Zoom. Your questions won't be viewable by the other attendees unless the panelists choose to respond. And after you start typing a question, you can choose to submit it anonymously if you so wish. We also recommend that you keep an eye on the chat box during this town hall, as we'll be posting links to some of the resources that we mention over the next hour. Make sure that you save those links if you're interested, as the chat won't be available after this event is ended. You will be able to view the recording of this town hall, as well as those links on the School of Graduate Studies webpage and YouTube page, beginning later tomorrow. So to kick the ball off, I would like to invite Vice President Lisa Barone to talk to us a little bit about research activities.
Thank you, Richard. I'm happy to be here today to discuss issues regarding research that are important to our graduate students. And so I just want to start out by saying one of the things I've been most involved with over the summer is thinking about how to be safe in what we're doing. And so one of the topics I would like to bring up with you first is that we have developed throughout our campus standard operating procedures for the research environments. And if you aren't aware of those standard operating procedures, please reach out to your major advisor or your department head so that you can review those standard operating procedures. These build upon the types of things Provost Galey talked about for campus safety during COVID-19. Second of all, I'd like to just talk about research in general during this COVID-19 period. We're in an uncertain time with an uncertain time frame to what we're experiencing, and that is affecting our research. Many things on the USU campus have been able to move forward, while others have had to slow or, in some cases, been suspended during the early stages of this pandemic. One of the things that's going to be most important as we move forward into fall semester is very close collaboration with your major professor and your supervisory committee, as well as maybe your department head. We recognize there are challenges that some of you are facing. Some of those challenges may require you to think about alternate directions in your research. And it's important that if you haven't started those conversations, that you do so very quickly. We want you to move forward with your research, but there are going to be some limitations that remain until we face better circumstances under the pandemic. And with that, I would like to specifically address one area of concern that I think some of you have, and that concerns human subjects research. Our interactions with human subjects in our research was suspended in March. Since that time, we have been carefully considering how to proceed forward so that our research subjects are safe in all aspects of the research. Over the summer, we put together an external panel that was comprised of leaders throughout our environment, health, the hospital system, the schools, to provide guidance on a framework that would allow us to make the best decisions we could regarding moving forward with human subjects research. I am pleased to say now that a framework that was developed by that external committee and recommended to our IRB has been adopted. And our IRB is now once again accepting protocols for evaluation to move forward with human subjects research. So if your research has been paused, I encourage you to reach out to Nicole Vuvalis, our director of our Human Research Protection Program, and her office to move forward with resubmission of your protocol under the considerations and framework laid out under the COVID-19 conditions. Next, for those of you who have other types of research that may have been delayed, I think there are going to be questions about how to move forward with completion, with funding. These are very important and challenging questions. I encourage you, as Provost Galey alluded to reach out to your major advisor and look at your plan moving forward with your research. There may need to be alterations in what you were planning. Our time frame is uncertain. And so I encourage you to have those conversations, and when issues arise, then come to us or your dean's office as well to discuss possibilities. I will say again, it is challenging in some of the circumstances we're facing, but not insurmountable. And I encourage you to reach out and hold those important discussions. Next, I would like to talk just a little bit about our animal-based research. In the spring, we did post a plan that was a plan associated with our animal research facility, the LARC. And there's a question that we've received already regarding how we will move forward if there are any outbreaks on campus. First of all, we are still under level blue of our LARC epidemic response plan. That level is only one step up from basic operation. All it does is basically give our director a little bit more discretion on the acquisition or movement of animals. Our LARC epidemic response plan is based in our ability to care and support the animals that are involved in our research. And so yes, we remain under that plan, and I will be happy to go over it with anyone who is concerned about the triggers within that plan and how we would be communicating with the campus. I will guarantee you right now that we would be communicating with each step, should we have to take it, in that LARC epidemic response plan to make sure that all researchers are fully informed. And with that, I think I will pass it back to Vice Provost Richard Cutler and welcome any other questions about research later.
Thank you very much, Lisa. Greatly appreciate that input on research matters. And we know you've got a busy schedule, so thank you for taking the time to be with us. A couple of questions that came in advance of this meeting, we put into Vice President Burrow's list of things to touch on. And so I hope she has, well, I know she has addressed the questions that were brought up that pertained to research. So now I would like to introduce and turn the time over to Vice Provost Janice Bettinger. Janice is also the Director of Global Engagement, and so she will be able to answer some questions down below on things relating to international students. In this segment, Janice is going to talk about teaching and the various guidelines that have been developed at Utah State University for teaching in fall semester. Janice?
Thank you, Richard. Good afternoon, everyone. If you are a teaching assistant, whether you are teaching a section of a course, a laboratory class, or assisting with either classroom, laboratory, or field activities, you are an academic support professional. On the COVID-19 page, there is a link under University Operations for academic support professionals. The guiding principles I think we all need to consider as we enter into this fall 2020, the keys are communication and compassion. It is more important now than ever to communicate. Communicate again, you probably are never going to communicate too often, repeating the message too many times. It's really important to communicate verbally, by email, in your Canvas course. The second one, compassion. We're all going through a really tough time. So be compassionate. Students may get sick. They may struggle with the material or the delivery method. Hear them out, understand that it's not easy, and see what you can do to help them. There are a lot of resources for students. First of all, with virtual interactions, before I move on to the student piece, there is a nice section in that academic support professional guidelines with a lot of tips on communicating and interacting with students virtually, whether it's in a classroom, in a laboratory, or in office hours. Also face-to-face interactions. You may be on the phone with a student, or you may have a office hour or some other kind of interaction, small groups or meetings. There are some guidelines there that you could follow. In terms of student support, there is another tab under University Operations on the COVID-19 webpage that is called Academic Support. Send your students to that link. There are some great resources from everything from getting the technology to using the library to understanding how to receive those lectures. For you teaching, many of you are going to be teaching in an online environment. You might be doing a completely online class. You might be doing a web broadcast. You might be doing a hybrid face-to-face. There are some great workshops that are available from Citi. And so at this link under the COVID-19 academic, there's a box on the right to Citi workshops. Click on that link and then follow through the calendar and you can schedule a workshop. I participated in 3 Citi workshops last week and I grew in terms of, I don't know, phenomenal growth for me in terms of using Zoom, interacting with students, letting students do group work and breakouts. It was really, really helpful. Okay. Many of you will still be in the classroom. You'll be in that laboratory or you'll be out in the field or you'll be in that discussion section with some students in the room. The COVID website under University Operations also has a tab for in-person teaching resources. There are classroom protocols. In fact, I did a dry run this morning of my class with a few of my colleagues. And the classroom protocols were really helpful for me to follow, getting the students in, getting them to sanitize their hands, sit down, and then to leave the room. Teaching lab protocols, the same thing, really useful link from that COVID-19 operations website. Students should not be sharing equipment or sharing lab space, and there's a lot of great things to keep in mind as you're in that classroom. We've also been getting some questions about what if I, as the instructor, get sick? Well, I've heard the term how we have to be nimble and we have to pivot really quickly. So all of us should be prepared to have someone else step in and teach our class or our section or our lab if we get sick. So preparing things in Canvas, having guides available so that someone else can see what you've put together and step in with as little preparation as possible and take over for teaching for you. If you're well enough to teach, you may be able to teach remotely from your location. So again, even though you're in an in-person setting, you may end up having to teach remotely sooner than you think. So take advantage of those Citi workshops. What if your students get sick? Okay, here comes again the compassion piece. We need to be compassionate for our students. Refer the students to the guidelines, student affairs, well-being, and also for the COVID-19 site, if you are sick. It's so important for students who are sick to complete that COVID-19 questionnaire, which will kick in the intervention by the COVID care team. I think that's all I have for teaching. I can answer some questions later in the Q&A. Back to you, Richard.
Thank you very much, Janice. Just want to express my thanks to Janice. She's got a full-time job as a Vice Provost and Director of Global Engagement, and she took on the task of acting Vice Provost of Graduate Studies throughout July. And since I have taken over the position, Janice has just been unbelievably helpful in working with me and continues to be very actively involved with the School of Graduate Studies and many of the initiatives that we are undertaking. I want to take just a little bit of time to talk about graduate student health insurance. I did send out some emails on Friday, August the 7th to all graduate students, but the issue is so very important, I think, that I want to spend just a few more minutes talking about it here in case you didn't get those emails or you weren't able to read the emails. So graduate student health insurance for individual graduate students and for dependents is going to continue through the 2020-2021 academic year. Now, there's been a substantial increase in the cost of the premiums over last year, about 27%. That's in large part due to claims in the dependent care coverage. The central administration, through Provost Gailey and President Dockett, found some one-time money to cover the departmental portion of the increase, but this isn't sustainable in an ongoing way. And so this fall, we're going to send out a request for proposals, and it's going to be written to solicit bids from vendors of health insurance. You are going to be represented on the committee writing the RFP. The Graduate Studies Senator, Alex Braga, has agreed to serve on that committee and will be meeting for the first time very soon. Due to the cost and claims record, we don't think that we're going to be able to offer dependent care coverage in subsequent years beyond this year. We did a very informal, non-random sample of research-intensive institutions in the region, including the University of Utah, and we found that none of them offered dependent care. So we're in very much the same boat as many other research-intensive institutions. Depending on the bids, we do hope that we will be able to slightly expand the coverage for individual students and perhaps to include some dental coverage, which graduate students have been asking for quite some time. We'll just have to see what kind of bids that we get. In addition to formulating the RFP, graduate students are going to have the opportunity for input into the process of selecting a new provider through the representatives on Graduate Council. So I think I don't really have to say it, but I will, that our goal here is to get the absolute best deal that we can for graduate students at Utah State University in terms of coverage. If there are any questions on this issue, I will field them later on once we move to the question and answer portion of this town hall meeting. Right now, I'd like to go back to Janice to talk about mental health resources at Utah State University.
Hi again. Mental health and wellness, it's so important for all of us. We are in a really stressful time, the COVID-19 pandemic, all the new changes here at Utah State University. The best place to start, I think, is to go to the COVID-19 webpage and look at the Staying Healthy tab, and then under that is mental wellness. There are many resources available. Counseling and Psychological Services, otherwise known as CAPS, has many, many resources on their websites. Remember, if you've been here the last year or so, you voted as students to increase your student fees to help support mental health resources through CAPS. Appointments can be made through CAPS and first a consultation to see what kind of assistance you might need. And because of your fees, the wait lists are down. In fact, right now, I don't know if there are any wait lists at CAPS. So don't be shy, access the resources at CAPS that you deserve. CAPS also has many what we call self-guided resources. So if you're not sure you want to talk to someone or you want to start somewhere else, go to that mental wellness page, scroll down, and you'll see the USU self-guided resources. There's a self-guided resource library that has videos as well as modules, documents, brochures that can help you. There's also the ACT, or Acceptance and Commitment Therapy Guide. This is something that was developed by professors in psychology here at USU and their graduate students. The program is free for students for 6 months, and it's also now available to the general public for only $10. So ACT is quite a resource. I have to admit, ACT helped me with some issues that I was having a while back. So I understand how it works, and I think it's a great place to start to improve your mental wellness. Another website is the Aggie Wellness website. And just went into the chat. This will help guide you depending on which location you are at. If you are in Logan or Price or at any of the other statewide campuses, you can navigate through there to see what kind of face-to-face, well, not really face-to-face, but in one-to-one meetings or other resources are available for you at your location. Lastly, wellness includes mental, physical, and relationship wellness, and wellness in terms of helping others. Remember that it's hard for you to take care of your students and your families if you're not taking care of yourself. So I really cannot emphasize enough how we need to look at our wellness from all aspects. Maybe you've been stressed and you've been eating too much and not exercising enough. Take a break, step back, take a look at these resources, get outside, and take care of the full wellness picture. Thanks, Richard.
Thank you, Janice. I think you're up next too to talk to us about diversity and inclusion.
That's right, I am up next. Okay, I think it's important to remind us that Utah State University believes in fostering respect and dignity for all members of our community. We want to address sexual misconduct and discrimination in all of its forms. The Office of Equity is there to help us do that. If you are a victim of or you are aware of discrimination, harassment, or sexual misconduct, make a report through the Office of Equity. That's one way. The other way is through the MyUSU portal on the right-hand side. There are links to ways to make those reports. Secondly, the Office of Equity can help provide information on supportive measures, resources, and they will be the entity that would conduct any formal investigations. There is also a notice of non-discrimination, and so if you want to read that fully, we'll put the link in the chat for that full notice of non-discrimination. I'd also like to emphasize President Cockett and her initiatives and priorities. In President Cockett's State of the University address in October of 2019, she laid out her presidential priorities, and two of them relate to equity, diversity, and inclusion. One of them, increase the diversity of students, faculty, and staff at Utah State University. And secondly, to promote inclusiveness and respect across the entire USU community. She also has several initiatives. The first one is the Diversity and Inclusion Task Force. In late spring of 2019, President Cockett called together this task force, which has representation from all the entire university system. And I am one of the members that serves on that task force. We have been charged to conduct a campus climate assessment. You might remember from fall of 19, having to, being asked to take part in that survey. We've put the link in the chat for the explanation about the survey, and you can look at the results. Secondly, overall, develop and oversee the implementation of a 5-year strategic plan. So we still have not delivered that plan to President Cockett yet, but some of the things that we're looking at, like in the short term, is creating and funding the Association of Graduate Students of Color. That would be a partnership between the School of Graduate Studies and the Inclusion Center. We're also interested in increasing support for the Inclusion Center and also for funding more diversity initiatives on campus. We are looking forward to having additional training and organizational change, including suggesting the possibility of investigating whether USU is right for hiring a chief diversity officer. Like I said, the report has not been delivered yet to President Cockett. It's not in its final stages, but stay tuned for that soon. Another initiative of President Cockett's is the Aggies Think Care Act. This is a cultural initiative to foster a caring community that elevates the academic experience and prepares all of us to become global citizens and leaders. It is also so that we all value the principles of community. What are they? Diversity, human dignity, and social responsibility. So I encourage you to go to Aggies Think Care Act, take the pledge for that principle of community, and see what else you can involve yourself with. Even if you don't belong to an organization or you're on a task force, each of us in our daily lives, whether we're in the classroom, the research lab, or out playing in the legacy fields, we can stand up for people who are not being treated right. We can cultivate respect for each other in the community. Okay, just wanted to remind you of a couple of things in the news just to demonstrate how President Cockett is so passionate about diversity, inclusion, and respect. President Cockett sent out a message after the death of George Floyd, and we'll put the link to that in the chat box. And also of interest to international students, President Cockett signed the amicus brief supporting Harvard and MIT's lawsuit against the US Department of Homeland Security with a July 6th rule change that would have threatened the status of international students across the entire US. And because universities like USU stepped up and the message was, international students, you are welcome here, the rule was rescinded 8 days later. Okay. Looking forward to working more with you on diversity, inclusion, and equity efforts. Richard, I'll send it back to you.
Thank you very much, Janice. Diversity and inclusion is a very important topic, something that we will be spending a lot of time and effort on throughout the next academic year. I just wanted to let you all know that the School of Graduate Studies has a graduate diversity recruitment officer, Jamal Jared Alexander, and Jamal Jared and I have established a discussion, and we're going to be meeting by Zoom next week and laying down some priorities for some initiatives over the upcoming academic year. We're now moving into the question and answer portion of this town hall meeting. And I would like to begin by introducing Trevor Gill, our senior coordinator in the School of Graduate Studies. He's going to be directing the questions that you ask to the different panelists. In an effort to get as many questions as we can, Trevor's probably going to be combining some similar questions. So as a reminder, you can submit questions through the question and answer feature at the bottom of your Zoom window. Take it away, Trevor.
Thank you, Richard. We have received a number of similar questions about COVID-19, so I'm going to read out several of them so that they can be addressed together. The first one, if a student, advisor, professor, coworker, etc., that a grad student has been in contact with tests positive for COVID-19, will you be paying for the testing of the grad student's partner, married or not, and or roommates? Grad students that have to TA and really don't have a choice of in-person versus online are putting themselves at risk for the university. How does the university plan on supporting grad students and their families or other people they live with in the event that the student is one of our classes test positive? Will there be any sort of screening to ensure students or professors are not coming to class with COVID, symptoms of COVID, or after being exposed to someone positive? What will be done if students do not follow prevention guidelines, whether it be on campus or off campus? How will the university respond to an on-campus outbreak? And does the university have a plan for what circumstances will prompt a shift to fully online course delivery?
Provost Gailey, would you like to jump in and start the answer here?
If a student or a graduate student feel they have signs or symptoms of COVID-19, testing will be provided. Right now, we don't have testing available on campus. We're working like mad to bring a laboratory up right here on campus. In the meantime, you're encouraged to go to your primary health care provider. For students, that would be the Student Wellness Center, the Student Health Center, basically, and they can guide you to where a test can be obtained. That's a short-term solution. Longer term, we are bringing up testing, like I said, on campus. There will be a testing site available where you can get samples taken, and then those samples will be tested. There is a contact tracing team. If you get contacted by that tracing team, that will indicate that somehow you've been identified as having been contacted with somebody who was positive. And in that case, that testing will be provided for you as well. The testing will be operated by Utah State University. Once it's up and running, will be free of charge to our students. All others are encouraged to go to their primary health provider. The really loaded question is, when will we have this testing program up and running? And right now we're waiting for some regulatory hurdles as much as anything else to get our laboratory going. Our goal is mid-September to be able to offer testing on campus. And until then, please go to your primary healthcare provider. And I think I may be repeating myself, but I'll circle back. If there's evidence that you may have come in some direct contact with a positive case, our COVID contact tracing team will notify you and will advise you from that point. If you or one of your students is asked to isolate or otherwise quarantine, then we do have a COVID care team. And I believe Nathan's already shared that link with you, but that COVID care team will be contacting you to reach out and make sure that they can help you with your classes as well as provide for other needs. That team will only know that you're needing that help or that support if you filled out the COVID questionnaire. So make sure, if you've been tested or otherwise contacted as a potential contact, please fill out the COVID-19 questionnaire. In terms of your roommates, if your roommates are on-campus personnel, they will be receiving contacts and testing through USU. Other housemates or relatives would need to contact their primary care physicians for testing. In terms of when might Utah State University have to pivot to go remote? That is a loaded question. It depends on a number of factors, a lot of which have to do with either clusters of infections if they were to pop up, or if the overall contact tracing team, for example, was to be overwhelmed or something. I don't anticipate necessarily we would go entirely remote, although it could happen. There may be parts or pockets of campus that will go remote or have to isolate. So at this point, we do have various rubrics that we're looking at, and we're watching very closely. Can I predict when or what might trigger us to go remote? I can't. I might be able to tell you what might happen tomorrow, but I can't tell you what's going to happen in a week with this. And so be aware that we will be communicating with you. The only advice I can give you in terms of whether we go remote or not is be ready to pivot. If you're the primary instructor in a class, or if you're working with your instructor, talk with your primary instructor about what their plans are should we have to move to a remote education. So all good questions, maybe not full answers to all of them yet. We're still working our way through a lot of issues, but be aware that testing will be available on campus mid-September, and until then, work through your primary care physician or the wellness center.
Thank you very much, Provost Gailey. I know that this is occupying nearly all of your spare time right now, and that you're keeping a daily track, perhaps hourly track, on the COVID-related things here at Utah State University. And so I just want to make sure that that our listeners are aware that this is not something that's on a back burner. We're keeping up on it, and every day, every hour of every day, monitoring and trying to make sensible decisions as we go through. Thank you.
Okay, the next question we have, USU has temporarily suspended the ACT, SAT test requirements for undergrads due to logistical, test prep, and admin disruptions during the ongoing COVID-19 pandemic. These same issues impact the GRE. Why hasn't SGS temporarily suspended the GRE requirements for prospective students as well?
So I'll jump in and answer this one. So when undergraduates come to USU, they often don't know what they will ultimately major in, whereas graduate students They apply to very specific programs in specific disciplines. And so the decisions about standardized testing requirements have been made at the disciplinary, that is to say, departmental and college levels. Some units have chosen to suspend standardized tests for the duration of COVID-19, while others have not. And some have chosen to allow students to submit test scores after they've started the program. These decisions have all been made in the appropriate academic units, the departments and the colleges.
Will tuition be prorated for facility limitations due to the pandemic?
Yes, President Cockett has already announced a $150 reduction in student fees for fall semester. There's no reduction in tuition, but yes, there is a reduction in the fees for the facilities that will not be available during the pandemic. Pardon me.
What financial accommodations are being made for those of us whose research and graduation has been delayed by COVID? This situation has required that we pay thousands more dollars of tuitions per semester that we wouldn't have needed. Despite making many requests, the university has been slow to hear or offer assistance.
Yeah, so we are very aware and very sympathetic to the plight of graduate students whose research and graduation may have been affected by COVID-19. And that includes many people who were working with human subjects, and that was suspended back in spring semester. So I don't have a perfect answer here for you, but I know that a number of departments have been very flexible in coursework requirements and timelines for research. There are not a lot of resources that may be used here, but there look to be some tuition waivers that we might be able to allocate. Tuition waivers that were not committed in spring as they had been in the past. And we are working on developing some criteria and an application process for getting access to these funds.
If I can jump in on this one, Vice Provost Cutler, I might also add the first place to go if you have a concern about a delay in your research is to your major professor. And you should be already in a planning mode to, as Vice President Barreau indicated, in a planning mode to see if your research can be adjusted in a way to get it completed in a more timely fashion, or to readjust it so you can complete on time. We understand that time is money as well. We want our graduate students to progress. If you do find yourself delayed, the first stop is your major professor, and the second, the department and the college. If for some reason they need some help, that's where they can contact Vice Provost Cutler for some potential help. We don't have a limitless sum of additional waivers and whatnot. We do have just a few, and we'll be working with the deans on an individual basis if there are some special requests there. And so I think we really need to circle back to your major professor on those.
Most of my classes are still in person. What will be done so I can still stay caught up in class and receive instruction if I had to quarantine for 2+ weeks?
Should I take that, Richard?
Yeah, please.
Yeah, as I mentioned earlier, be ready to take your classes online. Be ready to work with your instructor. Ask for help if you're having difficulties with the technology. Be proactive about your situation. Communicate. And if you communicate your situation, I'm sure your instructor will be compassionate.
Thank you, Janice.
Several of my courses say they are blended or something similar. What does this mean? Will there be some face-to-face interaction of some kind?
I'll jump in on this one. Blended learning methods, which are sometimes called flexible learning or hybrid learning, can vary greatly. Usually there is an asynchronous component, which could be online work or viewing video recordings in Canvas. and there is a synchronous component. Now, in the past, the synchronous component was usually face-to-face, but in the time of COVID, it may be through video conferencing software such as Zoom or WebEx. The best way to find out the exact form of blending that's being used in a class is to contact the instructor of that class.
I'm planning to defend this fall semester and then apply for OPT. Is there any change of OPT application? May I still submit the application 3 months before my program ends?
I'll take that one. So OPT, optional practical training for international students who are nearing the completion of their degrees. You must apply for OPT within 30 days of your DSO entering the recommendation for OPT into SEVIS, and up to 90 days before your program end date. And that's the SEVIS program end date. If your anticipated degree posting does not match your program end date in SEVIS, make an appointment with your primary advisor in the Office of Global Engagement to see what you can do about that. That reminds me, we did have several other questions from international students that were very specific to their cases. And so I'd like to say that in general, be familiar with the details of your visa, your program end dates, and the requirements for maintaining your non-immigrant student status. The USU's Office of Global Engagement is paying close attention to any notices that are coming from US Customs and Immigration Service. So, and they'll let you know if there are changes. If there's something specific to your case, please make an appointment with your primary advisor, and we'll put the link or you make that appointment in the chat box. Thanks.
What is the graduate school doing to take action against anti-Black racism and protect BIPOC students?
I'll take this one. As I mentioned earlier, Utah State University will not tolerate discrimination and harassment of any form. So if you are a victim of discrimination or harassment, please report it. Also, the campus culture, or not just the campus culture, but the university culture, the USU culture, let's all do our parts to cultivate trying to learn about each other, respecting each other, and to elevate all of us to a higher level of understanding and compassion and respect.
If a new bid is not obtained for dependent health coverage, what will be the options for graduate students to purchase coverage for their departments or for their dependents?
So one option is the Affordable Care Act exchange, which offers alternatives for dependent care coverage. And I think there are some options there which are less expensive than the one that USU can offer at this particular time. Sort of following in on this, I've seen a number of questions about the health insurance and the bidding process, and are we going to invite bids for dependent coverage, and what is the relative cost? I think we're going to find the answer to that through the bidding process as to what the costs will be for the health insurance with and without the dependent care coverage. And the overall goal is to try and keep the total cost for whatever coverage is obtained, down to something similar to what we have had in the past. A very substantial increase in premiums, as we talked about earlier on, is not something that USU can fund at this time. Did you have anything to say on this, Provost Gailey?
Not really, other than we're the baseline is we want to make sure that we can maintain the level of coverage, hopefully, that we are offering now for the graduate students themselves. And if we can find ways to improve that coverage with or without the dependents, we'll certainly try to identify those opportunities as well.
There's been a number of additional questions about health insurance, including the timing and dependent coverage alternatives, transgender surgical care, dental and vision coverage. And so the process by which we're going to go through this is initially to work on developing a request for proposals. And there's, as I mentioned earlier, there is a student representative on the committee that is going to do that. And hopefully we'll come up with something which allows for a number of different options that can be, priced. And this will give us some ability to look at the options, and then they'll be evaluated with input from the graduate students. For those of you who are using the dependent care coverage and for whom it is very important for your family, we urge you to get in touch with grad student representatives on Graduate Council, or to contact us directly over here in the School of Graduate Studies, and we will take your comments to the various meetings and committees that are working on this process.
Will the sports facilities be open this term, such as the squash court? If so, will we have to wear a mask to play?
I'll take this one, even though Janice actually provided me with the answer yesterday. The answer is some facilities are open and some are not. And we'll pop a couple of links to campus recreation that you can go to find out what things are available and what are not. You will find that at the moment, the racquetball / squash courts are closed. And so just keep checking back to the campus recreation links, and you will be able to get the latest information on what's available there.
My internet at my residence is unusable at times. What do you suggest for attending Zoom classes if I can't access them from my apartment Wi-Fi? Janice, would you like to take this question?
Yes, thanks, Trevor. If you are not quarantining, I would suggest coming to campus or to your closest USU facility, which should have high-speed internet. The library, the Taggart Student Center, many other places like lobbies and classrooms on campus will have the high-speed internet. So if you are able to go to a USU facility with high-speed internet, I recommend you do that. If you are working from home and your Wi-Fi is giving out, communicate with your instructor so they understand the challenges you are having. Especially if you are quarantining at home and you cannot go to a facility with higher speed internet. It's possible you can work out some kind of a plan with your instructor where you can get an extension maybe and watch the videos later when you have better access to internet.
I would add to that just for your information, as long as the weather is nice and holds out, we have expanded Wi-Fi access outside as well. And you'll see, if you haven't been to campus yet, as you walk across campus, you will see various tents and areas where our IT department have provided higher quality Wi-Fi in the outside environment as well. So hopefully there'll be places where you can stay socially distanced and still be able to work both inside and outside on campus.
Provost Gailey, I understand that Richard is the interim vice provost for the School of Graduate Studies. When will the search for the vice provost resume? I believe it began in March and was suspended.
The answer is yes, it was suspended in March. Richard generously agreed to step in the interim role. Decision on when and how to go forward with this position will be made next spring. Once we kind of get COVID-19, if not behind us, at least see a little bit brighter light at the end of the tunnel before we move forward. We felt it was important to get some interim leadership in for now, but rest assured, we will revisit this issue once the dust settles a little bit.
Why was communication about the Gmail to Outlook switch so badly executed? Can we expect enforcement and penalty for refusing to make the switch to Outlook?
Thank you so much for asking this question. Any employee of USU is issued a usu.edu email, and they are required to use that official email when they are conducting university business. What happened is the communication was not targeted to graduate students. It was targeted to any employee that we hire, and we might hire a handful of employees in a month. But between July and August, we hired hundreds and hundreds of graduate teaching assistants, graduate research assistants. And so because you were hired in that capacity, you got a very generic sounding email that made you think that you had to switch completely from Gmail to usu.edu. You should conduct all of your university business, official university business, using that usu.edu email address. But keep your ag email address, keep your Gmail address for all of the other things that you do. Frank, do you want to follow up on that?
I don't think I have a whole lot to add to that. When you're dealing with official university business or teaching or communicating with your students in the class, then we're required for a lot of reasons to use the Outlook. However, if you're communicating about a class where you are actually the student or on your own business, obviously the Gmail, we're not going to follow up on that.
If I could just plunge in and make one comment here. We've heard of some students who were, had a .usu.edu email account, and then because they weren't teaching over summer, it disappeared very quickly. We're working to try and fix that so that these accounts don't just disappear so quickly.
I heard from a faculty member in my department that the university's policies for who is designated as mandatory reporter is going to change soon. Is this the case? When will the shift occur? And will graduate instructor status as mandatory reporters change?
I can take that one, and then I'll let Janice follow up. You may be aware that the Title IX regulations changed this summer, and we had to do a bit of a pivot basically mid-August. We're also responding to some directives from the Department of Justice. So the short answer is there are likely to be changes on mandatory reporting, but there will still be responsibilities for directing students and others to the right and proper resources that they must be able to provide that direction to the resources. Mandatory reporting is still up in the air, and so I can't answer your question at this point. I would certainly refer a student to the right place to go and report if you feel you must. We will be getting that information out to you as soon as the latest round of regulatory communications, which I hope will be up in the next week or so. Janice, can you add to that?
I think you know as much as I do, Frank. Thank you.
How can we safely commute to campus, particularly for those of us who use Cache Valley Transit?
That sounds like another good one for me too. As part of our COVID stabilization team, we have a team under Ben Barrett and Facilities who's looking at a variety of issues, everything from lowering the risk of transit in buildings, as well as providing for safety, disinfection, issues like that in our buildings, looking at HVAC. You'll be glad to know that we've actually had to move some classes because the heating, ventilation weren't up to what we thought were safe standards. So be aware we're paying attention to those issues. And one of the issues they are looking at is our transit system. Protocols are being written now to provide for distance masking and other protocols at bus stops as well as on the buses themselves.
If I could just jump in and add something to this, perhaps anecdotal. Other countries, Scotland, I have family in, are very dependent upon public transportation. And so while the country has been mainly locked down, the buses have been running for transporting people to work, essential workers and the like. And I think the basic strategy for traveling on Cache Valley Transportation Department buses and the like is very much the same as in other situations that Provost Gailey has already spoken about, namely wear a mask, distance as much as you possibly can, lots of personal hygiene, lots of cleaning hands on and off when you're coming on and off the buses.
Other universities have had to move to online within weeks of in-person classes. What is USU doing differently that you all believe would be more effective than other universities?
Well, that's a loaded question. It's a good question. And I think there are a few things we're doing, one of which is looking at websites and whatnot from some of the other universities. I know President Cockett has really tried hard to build and build upon the great sense of Aggie community. And I know that may sound trite or light, but we're really counting on students to do their part and faculty to do their part. And to the extent we can all do that, we can keep our face-to-face options open and running. But that doesn't mean we're going to go forward full-heartedly. And if we do have an explosion in cases or something gets overwhelmed, we will be ready to pivot to a remote setting. We may not go wholesale remote. We might, but we might not. We might just have to close, for example, some sections or some areas. But I also think we have a couple of other things we're doing in a very tangible way that may help us, and one of which is we're doing some wastewater testing that will allow us to have an early alert if there's about to be a pocket of cases in a given area, and that might be able to help us advise students and provide them with the information they need to perhaps self-isolate or quarantine. So are we going to do a lot differently? No, we're going to be providing testing. We're counting on the Aggie spirit and the Aggie family. And we're also working very, very hard to reduce risk inside our buildings and count on people to also do the same outside of our buildings. But inside the buildings, we're working very hard to reduce risk. And I'm hoping that our measures might be, if you will, a measure above what others are doing. Anything to add to that, Richard and Janice?
No, I think you covered that perfectly. Thank you.
I'd like to say one thing. I think it's really important for those of us who are academic professionals to model the appropriate behavior.
Yeah.
So, wear a mask whenever you're in the building, wear a mask in the classroom, wear a mask if you're in the lab and your colleague says, look at this under the microscope. If we all do the right thing and we do it consistently, I think the behavior will be at a higher level of compliance with masks and social distancing and hygiene. So do your part.
Well, I think this brings us to pretty much to the end of this town hall meeting. So thank you all very much for attending this first ever graduate student town hall meeting today. My thanks also to Provost Gailey, Vice President Barreau, and Vice Provost Bettinger for their participation in this meeting, and to the amazing staff in the project management team in the School of Graduate Studies that have made this event possible. Don't leave quite yet from it, because we would like to have you fill out a very brief poll to give us some feedback on how well the town hall meeting worked in virtual format. It's new for us, as it probably is for you. The poll is only 3 questions long and it will only take a minute. And if you have any thoughts that you'd like to share, then please email us over at graduateschool@usu.edu. We're very pleased that all of you have chosen Utah State University for your graduate education. And though we're in the midst of a very challenging situation with the COVID-19 pandemic, we remain convinced that we can offer you a very high quality graduate educational experience here at USU. We look forward to working with you throughout your graduate careers here. If you have any questions following the town hall meeting, please reach out to us in the School of Graduate Studies. We'll be happy to answer your questions or point you in the direction of resources that may be helpful to you. Thank you to everybody.